are on the front lines of the pandemic too.
The need to have highly trained professional nurses within Lincoln Public Schools is essential. School nurses are public health experts. That is the purview that we fall into, is public health or community health nursing. So that part of our job has really been highlighted this year.
I would say the big piece is contact tracing. We want to make sure that we are identifying close contacts so that we can be sure that individuals are quarantining when they need to quarantine, so that we aren't having more infected individuals among crowds of people or out in the community.
If a school finds out that there is a positive case of COVID within their building, the school nurse goes into action.
We first need to confirm that that is in fact a positive case. So we do that either by connecting with their healthcare provider and securing that a documentation that way, or we talk to the county health department and make sure we have that confirmation.
Then is what the school nurse is doing is they're working with their administration in the building and teachers. That whole group is verifying that protocols were all followed.
And who was that student around? Who would be a close contact with? Were they within 6 feet for more than 15 minutes within 24 hours without a mask on?
Then if any students are identified, then the school nurse needs to contact those families. If those students are at school, we put them in our isolation room so that they can be picked up.
And then we identify those individuals accordingly and communicate to those families how long their quarantine might need to be, and obviously what signs and symptoms to watch for, and when to reach out to their medical provider to get tested. And then we do a lot of education and then messaging and working very, very closely with our administration here, the health department, and then our administration in health services as well.
We have an elaborate tracking system that does some automatic notifications so that we're making sure that everybody that needs to know about the positive case knows about the positive case. All of those are all pieces of the puzzle.
This year has been such a learning experience for all of us. It's definitely come with giving ourselves a lot of grace, giving our families grace, giving our students grace, and just trying to understand that we're all trying to get through this together.
Our health services staff have been champions. They just have accepted the challenge and kind of rolled with it.
School nurses are here for our students. That's pandemic or no pandemic. That's why we took this job. That's why we're here. Just some days are just COVID, and that's okay too. But definitely looking forward to the day where we get back to that more traditional role, where it's more nurse-student interaction.
You know, school nurses are not only contact tracers. We are putting together care coordination plans, individual health plans for students, and some of our students that we serve in Lincoln Public Schools are extremely medically fragile and could not be at school without having a nurse present.
I've always been proud to be a school nurse, but this year in learning something that is totally new in an unprecedented time makes me even more proud to be a school nurse and be part of hopefully the solution to this.